Nibley 12 board for the second time. This first video was recorded as 2 pictures, not actually as a video. Thank you, Sydney. So this month I wanted to talk about CPR. We were going to do water storage, but I went to a class yesterday where we talked about bystander CPR and kind of the importance of it. It was a pediatric resuscitation class, and it was very eye-opening. So a couple things I want to talk about first is Utah is below average for bystander CPR, meaning that people that witness a cardiac arrest either don't start CPR soon enough or they don't start it at all. We want to talk about your intact survival rates, meaning somebody that has had a cardiac arrest, be it an adult or a pediatric, how likely they are to leave the hospital with little to no neural deficits from ischemia, from not having any oxygen to their brain. So with no bystander CPR, your rate's 3.5% chance that you'll leave the hospital with no deficits. That's terrible. That's not great. That's not what we want. Our job as first responders is completely irrelevant unless bystanders start CPR. Bystander CPR with DA is dispatch assistance. When you call 911, the dispatcher will tell you if you need to start CPR, when to start it, and how to do it. But the thing is, people will sometimes say, no, I don't want to do that. Okay, you'd be surprised how many times we read through notes on a call and somebody doesn't want to start CPR. Your survival rate is 8.6% because there's a delay. Somebody has not started CPR immediately. Bystander CPR with no dispatch assistance, your survival rate goes up to 13%. That's the best we can get, and that's the goal we're shooting for. And the only way that we're going to get that is if somebody else starts doing CPR. So I want to talk about indications for CPR because this is kind of the scariest thing for anybody to do. They see an emergency happen, they sit there and look and they go, oh my gosh, I don't know what to do. Okay, if you see these indications, start CPR. If they wake up and they grab your hands and throw them off their chest, perfect. No harm done. Their chest will hurt for a little bit, they'll scream, they'll yell, but they'll be alive. If they are unresponsive, okay, when we find somebody on the ground that we suspect is having some type of cardiac event, we go up and we shake them, we yell at them, we can do a sternal rub, press really hard, try and cause pain to wake them up. If there's no response, check for breathing and a pulse. You don't necessarily have to check for a pulse, they're kind of tricky to find sometimes, but check for breathing. If they're not breathing, or if they're just gasping, or if it's a very irregular and slow rate of breathing, you can now start CPR. It is indicated for you to do that. So I want to talk a little bit, oh yeah, and check for 10 seconds. Like when we go on a full arrest, we check for 10 seconds. If we can't find anything in 10 seconds, we start doing compressions. So I want to talk about compressions and breathing really quick, and we'll do a little demonstration while we do it. So we're going to do compressions at a rate of 100 to 120 beats per minute. Now when I do CPR, I get really close. I sometimes straddle their arm, but I try and get as close as possible because your lower back is really going to hurt. You put your hand in the middle of their chest, right on their sternum, with this base of your palm right here, and you want to be able to push down at least 2 inches and allow the chest to come up completely. You need that recoil. So to get the 110 beats per minute, I sing Baby Shark while I'm doing CPR, and I'm 100% serious.
Sing it.
I'm not going to sing it. Not right now. I sing it in my head because I don't want family to hear me singing Baby Shark while I'm doing CPR on their loved ones. So we're going to do that. You technically are supposed to do 3 to 5 rounds of CPR before calling 911, but with stuff like Siri and Google Assist and speakerphones, dial 911, sit it down, start doing CPR, talk to the dispatcher. Okay? When we are doing CPR, it's no longer required that we breathe for somebody. It's called hands-only CPR, where you're just doing compressions. Remember, 100 to 120 beats per minute, 2 inches down, and full recoil, okay? It's super important to get that recoil. If you are going to breathe for them, if it's a loved one or somebody you know, you can do a head tilt, chin lift, put your mouth around theirs, blow into it for 1 second. Don't blow super hard, blow like you're breathing. You just want a little bit of chest rise. You don't want to cause trauma to their lungs. You'll do 2 breaths for every 30 compressions. And with kids, pediatrics, airway is the most important thing. It is the priority. Their heart is healthy, The issue is that something has happened to their respiratory drive or something is blocking their airway. If you can see something, go get it. Pull it out. Turn them on their side. Do back blows, compressions for little kids. There might be something stuck in there. So a couple techniques for doing CPR on little kids. Depending on their size. Little babies, you use 2 thumbs. Or you can use your fingers like this. Same location though, center of the chest, same rate, 100 to 120 beats per minute. Or on school-age kids and teenagers, I've done one-handed CPR before and it's effective, okay? I think that about covers it. If you see something like this happen, please take action. It is important for the survival of other people that you do something before first responders get there. Thanks so much, everybody, and we'll see you next time.